Agriculture Minister John Steenhuisen says his department is implementing critical measures to turn the tide against foot and mouth disease. Steenhuisen says more than 270 cases have been recorded across 5 provinces and a total of 50,000 vaccine doses already administered. It's part of the 900,000 procured by government. Let's talk about these interventions, the impact on the ground with the Karan beef senior feedlot veterinarian Dirk Verwoerd to find out the extent of the outbreak, where they are and whether these interventions and government's plans are effective. Dirk, good morning to you. Thanks for your time as always. Really do appreciate it. And I said in the intro, that the Agriculture Minister had said that this was turning the tide. Their government interventions were against foot and mouth disease. From where you are working, from what you're dealing with every single day, with hundreds of cattle, thousands of cattle under your care, does that statement match the reality that you're witnessing?
Yes, thank you very much for the opportunity. I think there's been great progress in the last few months, really well facilitated by the Minister Steenhuisen. Those doses that you mentioned, more than 500,000 already applied. The disease was running rampant in southern Gauteng, southern eastern Gauteng, and even parts of northwest. Every week we hear about another feedlot that's been affected and stopped essentially in its tracks. So yes, the situation was really dire. We've made great progress. The registration, the identification, all of those things are essential building blocks that was neglected for a very long time. So at the moment, the current beef wheels are slowly starting to turn again. We've started slaughter at 2 of our facilities. Some of the movement of cattle is happening into those abattoirs, etc. So it's creating space. But as I said, every day, just about you hear of another outbreak somewhere. So we've got a temporary respite at the moment with the vaccines that were used. Also the season, that's in our favor. Dry, dusty, windy conditions are not friendly to virus transmission. But I think everything can change the moment the rain breaks. So we have to progress. We have to keep going this way. And what makes me really excited about the future is the announcement by the minister yesterday of the task team, the dedicated task team, which will hopefully bring back the science into veterinary science. That's been lacking for several years now in the policies and the protocols and so on.
This is really encouraging to hear, Dirk, because when we think about the importance of beef in, South Africa's growth ecosystem, this part of our agricultural sector, it really is important. And, it's at such risk, as we've seen with FMD over the last couple of months. So I'm glad to hear you say it's well facilitated. It seems as if the doses that have been allocated have been administered. They're reaching the places that they need to go. Let's talk then about the aspect of livestock auctions and isolation practices, which have been cited as one of the reasons FMD has been allowed to proliferate. What about our biosecurity enforcement complex? You did talk about the announcement around the task team, something that's been missing in the response complex. Are farmers, or have farmers hitherto largely been left to their own devices where this is concerned? And how practically do individual farms respond to the calls for isolation practices and the like?
Yes, you're absolutely right. That's one of the key issues, and the whole thing about spreading the disease. It doesn't happen by itself. It spreads with cattle movement and cattle congregations in auctions, in open herds, for example, communal herds, where there's coming and going every day. So all of those things play a major role, and we have to address those pressure points, mixing vessels, as they say. And this is what part of the regulations are about, and why the traceability systems in animal identification and so on is critical. The use of quarantine facilities, of quarantining cattle before they move to another facility like the feedlot industry has established, that's essential. And unfortunately, it's not done at the same level or standard everywhere else. But the main gap in our arsenal is always the vaccines. There's not enough vaccines available to address the issues as they appear. Disease management areas are proclaimed, and there's so-called movement control and so on. But if you don't use vaccines inside that area and you don't stamp the whole disease dynamic out, you haven't achieved much.
Yeah.
And so these 1 step forward, 3 steps back situation, that's been going on for the last few years.
I'm going to make a little bit of an assumption, but it's based on what we've witnessed, you know, in the agriculture community, that in some areas, you know, there is a network of farmers, there is communication, people talk to each other about what's happening individually. Karan beef, of course, is one of the major suppliers, one of the biggest in the country. What is your knowledge, Dirk, of the experience of, the distribution of vaccines and being able to adhere to some of the calls made by the ministry in terms of isolation and managing livestock auctions and so on among some of the smaller players? How capacitated are they from you know, based on your observation?
Yeah, it's always a mixed bag. You know, some people really play the game correctly according to the rules and so on, and others just ignore it completely. So you have small-scale speculators that would buy anything from anywhere. There are people that move small amounts, numbers of cattle in small trucks and so on through the night, and those things happen, and we know about this. By and large, I must say, and I think this is important to say, that the provincial veterinary services are extremely dedicated. We work with all the provinces. Individuals are very professional, dedicated, everything. So the situation is not for lack of trying by state officials. But policy is unfortunately not appropriate, and we see the scoreboard, and that's a sign of inappropriate policies to the situation that we face with here in Southern Africa. It's different from Europe, it's different from South America, and we have to find our own ways and solutions, and this is the path we are on, and this is where the task team will actually make the difference.
Talk to us about export markets like the EU and China. I understand that those markets are at stake for us right now. Explain from your perspective the damage that has been caused for a major producer like Karan beef in terms of cost, market access, and I guess more importantly, consumer confidence.
Yeah, I think our first responsibility is always our own consumers. So that's always the very first priority. We must look after our own people, and it's about food security for South Africa first. Now, part of that economic engine, obviously, is an element of exports. The big export areas is not the European Union, it's the Middle East, it's Saudi Arabia and Middle Eastern countries, and they are less concerned about the FMD situation than is often said. They have FMD in their countries. They have effective control programs in their own countries. The export agreements and so on accommodate all of that. China is different. China has their own agendas and how they play the geopolitical game. They also have a lot of FMD. They don't have the SAT types. So there's maybe a technical issue there. But always remember, in terms of exports, the biggest exporting country in the world in beef is Brazil. And they built that status in an era where they had 100% compulsory vaccination. So vaccination against FMD doesn't always block all doors. And we should not only look at the European Union as the target market. There are exceptional markets in Southeast Asia, in other parts of the world, where we can access that.
Yeah. I'll come in a moment, Dirk, if time allows, to whether when we see the back or the rump of this crisis and put that behind us. We often don't talk as much in these conversations about the impact on the animals themselves, on their well-being, and how this affects herds in terms of the systematic or systems responses to an outbreak such as this. You're a vet, so you're up close with these animals. Just talk to us about how it impacts them directly.
Okay, so it's important to realize that the Southern African types that we deal with here are milder than the ones that one read about, the O types, Asia and Asia 1 and so on, in other parts of the world. So that's the first distinction. A very small percentage of cattle in a herd that's affected will actually show clinical signs, 10%, 20%, thereabouts, not the 80% and others that we hear about. The mortality in young cattle, that is also reported in the other types. We see much milder presentation here. So we must actually distinguish first the difference in the strain, and secondly in the production system. So it is very serious in dairy cattle under high production stress, and also in feedlots. We see a much bigger economic impact in those intensive production situations than, let's say, in an extensive herd or in a communal herd. There will be mild lesions in the mouth and a bit of lameness and so on, and then it's over. In a production system, it's completely different. So there's a very big impact on the growth, on the health of the cattle itself in a feedlot and also in a dairy. So we have to look at every outbreak in the context of that production system. And there's a very serious animal health issue in the high-intensity production systems.
And when we put the animals out of their misery, for those who are for those who are suffering, how does that happen humanely?
Yeah, well, it is controllable, of course. We use anti-inflammatories. We use some antibiotics for secondary infections. But some of the damage, for example, the udders of dairy cattle, some of them are so destroyed that it's beyond economic repair, and they have to be culled, they have to be slaughtered. That brings another element to the equation, and the same with the feedlot. So you cannot do that while you're under quarantine and you don't have an abattoir that you can send. So the only option at that stage then is culling, and humane culling. And we've had to do that for a number of animals, unfortunately, under our care, because you cannot just allow the suffering to continue. You just have to take control of the situation. Once you reach day 42 after the outbreak, then a lot of other options open up. And you can start slaughtering, for example, and then you have those options to economically salvage the animal.
Yeah. Well, I think the vaccine facility, a domestic one, South African-based, from what we understand, is only going to materialize about a year from now, I think 2026. So, what should it be happening in this moment, Dirk, to ensure that we do have the volume of vaccines that we need? We can also preempt further outbreaks and further spreads to be able to manage the herds and safeguard them.
Yes, essential point. Very good point there. So there is at least a 6 months or maybe longer period until the local production kicks in again. That's the projected timelines. We'll see what happens when it happens. But the volumes projected are also too low for our, let's say, the next 2 years requirements on a monthly basis for all the fires we have to put out, as well as the preventative vaccination programs needed. So we have to import hundreds of thousands, probably millions of doses still over the next 18 months to 2 years to address those issues. Only then we'll be able to work on a more focused strategy where we push back the virus to where it was. And that's another essential point here. This is a man-made problem. It is a man-made issue. It's not the result of droughts or floods or global warming or Trump tariffs or anything like that. It's a man-made problem. And therefore, the solution is also man-made. And this is where the team really can play the critical role. So the tools in the toolbox, the most important being the vaccines, we will have to import probably from several sources in the interim.
Dirk, I know that you've got a busy work day, so I really do appreciate you stopping by and just sharing with us your perspective on the outbreak of FMD and some of the intervention measures that were announced yesterday. I do appreciate your time. Dirk Verwoerd is with Karan Beef and is their senior feedlot veterinarian.